12:29 it is, and we're almost at the end of our Land 70 podcast series for this edition. And before the break, we spoke to Dr. Mohammed Musaji, and it gives me great pleasure now to invite our very special guests who will be talking to us about the establishment of the very first private hospital in Lenasia, Lenmed Private Hospital. To talk to us about it is Dr. Faruk Kaka, who is a general practitioner and Bachelor of Surgery, and Dr. Rashid Ahmed Ismail, an obstetrician and gynecologist. Assalamu alaikum and welcome to the program.
Walaikum salam. Thank you.
Walaikum salam, and thank you for having us.
Yes, I think this was an extremely important discussion to have, because I think now Lenmed or Ahmed Kathrada Private Hospital boasts a huge, very successful hospital, and we'll talk about the group a little later. But let's talk about why it started and the reason for its establishment. So, Dr. Ismail, if I may start with you, when did it all start and why?
Okay, so this was in the tragic apartheid days, when once we qualified as specialists, we had no place to practice in. The law said that no black specialist can work in a private clinic. So they would allow patients in, but would not allow the doctors to work at those clinics. And we were stuck in Lenasia with patients that we're attending to, with no clinic to deliver them in or to operate on. So we used a public hospital, government hospital, Leratong Hospital, to admit our patients and treat them there. The conditions weren't very good. Patients were treated as hospital patients, and many of the nurses would refuse to see them because they were private patients. So we ended up going to Leratong Hospital, sleeping on the floor and attending to the patients, even helping to admit them, take them to the labor ward, and sit with them throughout their labor. It was a very trying time, and we felt that we had to build our own private clinic where our patients could be treated. It was quite a mission in the middle of the night to travel all the way to Leratong Hospital to treat patients. And we were not allowed in any of the private clinics in Johannesburg.
Right. And just
So,
go ahead.
No, carry on.
Just so that we can give some context to what you're saying in terms of the distance from Lenasia and where Leratong Hospital is currently, it's what, 30 kilometers away, if I'm not mistaken?
About 30 kilometers. One would say in the Krugersdorp region, and we had to go through a very quiet road, and I mean, it was very risky to travel there at night.
Right.
But, that was a challenge we had to take.
Right.
So that resulted in the doctors. There were a few specialists at that time, about 3 or 4, not many. But we felt we were busy enough to establish our own clinic in Lenasia to help treat our patients.
Right.
The whole idea at that time was not a lucrative clinic, but one where we could service our patients. It was more for servicing than establishing a business.
Right. And so it's just, again, about accessibility. I've spoken about this over and over in our program when we speak of the spatial inequalities and its impact it's had on, eventually it's also your mental health, because one cannot access transport, education, and vital health care. When you describe, I think you're just reflecting on the past and the way you speak about having to sleep at the hospital overnight just so you could see to your patients. I think everyone can understand the depth of that statement, because it was about, in your field especially, one needs to be on standby at any time.
Yeah, quite correct. And it was trying. Also, we couldn't go into the Joburg city center to use the private clinics there. It was against the law, and the management of the clinics refused entry to us. They'd accept the patients, but not the doctors. Um, and
Sure.
at Leratong Hospital, it was a trying time as well because we were not very welcome there either by not all, but by a fair number of the staff.
Mm-hmm.
So it was probably a most unique situation. I don't think anybody in the whole world had a situation where we were transferred to a so-called Indian area. All people had to move there. You couldn't buy property anywhere else, and we had
Got
no medical facilities. So it was probably unique and a very challenging situation. And this drove
absolutely.
us to establish or try to establish a private clinic at that time.
Right. So, in what year was this? Uh,
Well, yeah,
Preceding the opening of
I would say
LandMed.
it was between 78 and 81 we tried to establish this.
Hmm.
Uh, so for 2 years, 3 years, we had this crazy situation where we had to go to a public hospital.
Right. Dr. Kaka, do you have a comment on that?
Yeah, I was then at the time a medical officer at Leratong Hospital, and uh, and therefore sort of encountered or could empathize with them because at times they wouldn't get through. Remember, those were not the days of cell phones. So
Mm.
sometimes they would, Dr. Ismail and Dr. Lateef and Dr. Prajapat, the surgeon, would have difficulty in getting through to the hospital, switchboard, and then they would call us and try to to get them to call them back so that they could communicate with the wards because they had patients there, and the emergencies were always a very worrying factor. Uh,
Hmm. Right. So you very much experienced what Dr. Ismail is describing in terms of the old dispensation and the difficulties that, well, Indians or people of color had at the time.
yeah, it was in 1976. I was working as medical officer in the surgery. I met Dr. Prajapat. It was my association with him that kindled my interest in this proposed hospital, the
Mm-hmm.
future Lenmed Clinic.
Mm.
My involvement in those early days being restricted at an unofficial level, attending meetings at the homes of pioneers like Dr. Mistry, Dr. Pakersamy, and Dr. Kazi.
Right.
Working in an apartheid-style hospital, Laratong, where we
Mm.
had separate tea rooms and separate change rooms and separate sleeping room apartments, made me
Mm.
dream of a futuristic hospital where we as non-whites would be recognized and work in a stress-free, desegregated environment. My colleagues
Right.
at Laratong considered this as a pie in the sky, but I believed and I dreamt. Though nowhere in my dreams did I foresee a 244-bed state-of-the-art multidisciplinary an institution where even major surgeries such as open heart surgery will be undertaken in January 2002. An institution where all specialities will be represented, an institution that we could proudly say delivers excellent healthcare in the most cost-effective manner, an institution where race, religion, color, or creed made no difference.
Indeed. Indeed. So it turned from a pie in the sky dream to what we have today. What were the initial challenges and how did you actually start then? I mean, just getting the land, first of all.
Yeah, well, Dr. Ismail was involved in that. I was unofficially attending meetings, and Dr. Ismail will be able to give you
Elaborate on
an
that.
idea and a full
Sure.
sort of picture of
The
what they
problem,
went.
if I can cut
Sure.
in there, the problem at that time was acquiring the land to build a clinic. There were no facilities, no land available. I mean, people had a battle finding houses for themselves or land to build houses. It was a diabolical situation. So
Hmm.
we ran around looking for the land because where else do you put a clinic but in a specialized area?
Correct.
So we eventually managed to get the land and established the initial building of the clinic. The problem at that time was finance, because we were just a
Okay.
handful of doctors. And to establish a clinic that size would cost millions of rand, even at that time. So the difficulty, the land, it took us 2 years to get land, and it took us another year to get the finances to start off the clinic.
Right. So, in terms of the bureaucracy,
Yeah.
was that challenging? I'm sure. How did you get past that? I'm sure that was all
Oh,
part of acquiring
well,
the land.
yeah.
Yeah?
Okay. So we spoke to the people in charge at that time, the so-called Lenasia Management Committee or whatever it was at that time. We paid no respect to them. It was part of the government structure. But because
Okay.
we needed the land, we had to sort of go with a begging bowl to say, please, we need the land, as much as we didn't want to be established with them.
Right, right.
So they saw right to give us the land, which we bought and started planning the clinic. We said, right, with the amount of money we had, and we went to the community to get the funds and the
Oh,
doctors, but it was very difficult because, as Faruk said, to them it was pie in the sky to establish a private clinic, uh, uh, especially seeing that the clinics in Joburg were so well run and were so busy. For us to establish a clinic in Lenasia was to many people a dream.
mm-hmm.
But we started off with a very simple structure, prefab structure that allowed 40 beds and 2 theaters. And it was prefab in the true sense of the word. I don't know if Farooq has some pictures, but we wanted to start, and the clinic was not there as a business ideal. It was there to service patients. And
Right.
that's how it started.
I was talking to Ismail Mohammed in the beginning of today's program, and we spoke about late Qasim Saluji and late Dr. Abu Bakr Aswat. And some of these ideas were then that materialized were actually from what he called in his article, very satirically put, uh, the stoop conversations, with
Mm.
samosas and hot tea, where the ideas then just materialized. So this was a community, that community spirit that brought about these kind of ideas that always pointed towards serving and keeping the community together despite the challenges. Dr. Kaka, do you have a comment on that? Yeah.
Yeah, coming in as far as the difficulties they faced then, like I said, I was attending meetings but unofficially, is the financing of the project. So the plans were drawn up for a multi-story building, which was going to costed at 5 million rands, but unfortunately, of course, like any other organization or businessman would do, is approach the banks, and the banks would not grant us any loans because we were non-whites, and you would know the difficulty those days of uh, obtaining loans from the bank as a non-white was concerned. So that idea to be given up for this 1.5 million structure that Dr. Ismail is referring to. So yeah, it's so. Once LandMed got off the ground, and 20 years later, and me very much involved with LandMed, it's so ironical that the bankers are now standing outside our doors begging us to take loans from them.
So
Aha.
just to add a
Sure.
bit, um, when we established the clinic and built the so-called prefab structure, uh, none of the people involved took any salaries. None of them drew any shares. It was all done uh, without any fees. And the whole idea by all the people involved was to establish a facility. And nobody was interested in the financial side on a personal basis at all. So this was a clinic for the people and to service the people. So that has to be borne in mind. What
Right.
Lenmed has grown into now is totally different to what the original plan was.
Right, and we talk about the corporate structure now after this next commercial break.
Hi.
Services from an award-winning firm? Look no further than the Belmont Mayer Group, your gateway to unparalleled investment and wealth management. At Belmont Mayer, we believe in the art of wealth creation, a meticulous process fueled by our unwavering commitment to excellence. With a focus on providing elite alternative investments and quality advice, we also pride ourselves on maximizing value for our esteemed investors as seen through our consistent outperformance. Your financial success is our top priority. Join us at Belmont Mayer and experience the difference firsthand. Ready to embark on a journey of greatness? Contact us today. Reach out to the Belmont Mayer Group on 078 786 1698. Call or WhatsApp or email us at info@belmontmayer.com. Elevate your financial future with Belmont Mayer, where every detail matters.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
World-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic Sharia and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
Make a conscious choice. Sip for change and support Palestine Drinks Africa. With every can, you help end the genocide and stand in solidarity with Palestine. Choose between our original or sugar-free options available in the case of 24. Every sip is a step towards justice. Every purchase a powerful message of unity and support for the Palestinian cause. Contact 082 888 1440 or 082 7739 556 today and be part of the change. Palestine Drinks Africa. Sip for change. Liberty for everyone.
Rejuvenating media day by day. This is Salam Media.
Our very special guests, Dr. Rashid Ahmed Ismail, obstetrician and gynecologist, and of course, Dr. Ahmed Faruk Kaka, consultant at Lenmed Health. Before the break, we spoke about the establishment of the 40-bed clinic, as it were, and you've watched it grow over the years. Give us your, an idea or a picture of how this hospital then evolved. And of course, because the demand for its service grew. Open to both Dr. Kaka and Ismail, who would want to answer that?
Yeah, look, the clinic was established to service whoever required it. Now, the environment involved was Lenasia South, Eldorado Park, Soweto, and all surrounding areas, Vereeniging, what have you.
Right.
And everybody was welcome there. There were no restrictions. And initially we battled. Many times we were sinking. There were no profits, and we battled to keep the clinic going.
Right.
It was only after more doctors came into servicing the place and the patient volume grew, and we slowly started turning the corner and started seeing profits. And the profits were
Right.
going to be used to increase the size of the clinic and establish better facilities. So Faruk can take it from there.
Mm-hmm.
So as demand grew and demand for more beds grew, the clinic underwent five up to the present time. The clinic went to 5 different phases of extensions to where we are today of 268 beds with all sorts of the modern facilities and facilities for cath labs and open heart surgery, etc., etc. So we went through all these different phases of extension, like I said. Also, what happened was that as Lenmed grew and time went on, we acquired other hospitals. The first one was a 30% stake in or equity in a hospital in Ladysmith called Laverna Hospital. That was in 1992. And then in 2004, we acquired a small little hospital in the Black Township of Tembisa, which was just a 37-bedder. And then in 2005, I'm not going to go through the whole list. I'm just going to end somewhere there. 2005, we acquired New Shifa Hospital. And this led to, all this were acquisitions were done under the banner of Lenmed Clinic, which became very difficult structurally and corporate-wise. So then the corporate structure was revisited, and Lenmed Health and Lenmed Investments came into being, and all these subsidiaries were then placed under that the holding company of Lenmed Health. And
Right.
that happened in 2007 when Lenmed Health came into being.
Okay. So, having moved into the new dispensation and accessibility becoming easier for the vast population, did you still face any challenges then, Dr. Ismail?
Well, I think once the clinic was running with full flow, patients pouring in, and more doctors coming in, no, there were no real issues after about, I say about 5 years, 6 years it took to really establish the clinic. And it reached a point where the clinic was always overflowing. So no, there were no other problems once the clinic was established.
Right. And so when you look at service and the renaming of the hospital quite aptly to Ahmed Kathrada Private Hospital, the Lenmed Group now, that is your flagship hospital, am I right?
No, well, it was always considered a flagship, but if you take in terms of size and capacity and performance-wise, the eThekwini Heart and Hospital Center in Durban has now become the flagship. If that is the way of describing the flagship, that is definitely our flagship as far as the facility is concerned, and has got a number of recognitions from the American Heart Association. And its heart center particularly is the best in Natal, having facilities for open heart surgery for pediatric patients too. And it has a heart foundation created where we do on social basis those in need open heart surgeries too.
Right. And I just remembered now in one of my interviews, I was talking to the TIBA Services of the Blind, when we spoke about social services that were established in Lenasia during apartheid. They recognize Ahmed Kathrada Private Hospital's engagement with them for the cataract project. So there's still the social engagement from the hospital side.
Yes, I can. Yeah, that brings back a lot of memories. Mr. Ibrahim Patel, who was then the chairman of TIBA, came to visit me, and we started off this relationship in 2007 when the first free cataract surgery was undertaken, and that has continued up to the present time. The patients come via TIBA, they are referred via TIBA, and they do the means test, and then we do them at no cost. Even the surgeons were being paid for their services from the hospital.
Right. A comment on that, Dr. Ismail?
Well, at that time, I had moved away, and I wouldn't know much about what happened at that time.
Okay. Well, what we're looking at now is that the LenMed group as such is, well, if you just look at the hospital, I beg your pardon, a leading private hospital group in Africa originated in Lenasia, South Africa in 1984. When that is seen, then again, because we focused on the LEN 70 celebrations and Lenasia being now its platinum anniversary, and we know what uh, I've been covering the different aspects over the 70 years, whether it be sport, education, healthcare, um, highlighting the arts as well. We see that it's a very proud moment for the founders of this clinic. And, hats off to all of you who thought of this out of compassion and, of course, the field you serve in terms of, service to humanity. It originated in Lenasia as such.
Yeah, it was probably one of the earlier black empowerment groups where we decided to take the law into our own hands, so to speak, and
Right.
establish our own clinic despite the laws around us. And
Mhm.
it was a struggle. It was difficult, it was hard, but we felt we had to do something ourselves and not rely on anybody else to help the community.
Right. Dr. Kaka?
Yeah, so Lenmed is currently celebrating its 40th anniversary. So as we celebrate this milestone, I think we are also celebrating the vision, strategy, and sacrifices of these pioneering visionaries. We salute them for their selfless contributions they made in establishing the clinic, and they were planting the seed of this magnificent institution this clinic has metamorphosed into.
Mm-hmm, mm-hmm.
Lenmed has
Oh, oops.
large, no, sorry, the fourth largest group in the country after the three big, major groups, which are predominantly white groups. And so we're the biggest as far as the non-whites is concerned, with 2,333 beds. And we have employment, just a moment, I just want to put a
Mm-hmm.
figure of 4,325 employees. I think as far as contributing to the economy, that's also an important, creating job creation is an important place to
Correct.
play. We also
Right.
want, I also at this moment want to say that LenMed social and corporate socially responsibility wise, as for the spend for the last year, as far as the total CSI spend was concerned, was 27.9 million rands in the form of discounts and various other corporate social investment that we've undertaken.
Mm-hmm. Well, I think that was an important point to make and for us to be aware of, because I think a lot of the private hospitals, so to speak, are looked at just profit-making machines. And well, it's wonderful to know that there is that consciousness about giving back.
Najma, I just wanted to come on, and it's still happening.
Mm.
You said the challenges we faced. For over all these decades, as uh, we as Lenmed Clinic, I think, and some other non-white hospitals were being paid differentiated fees by the medical aids. In fact, last week I
Oh,
thought this has been overcome, but it appeared again in the news last week about this happening and being challenged. But we were separated from the northern suburbs private hospitals as far as the differentiating in fees.
oh, that's very interesting. So, to both Dr. Ahmed Faruk Kaka and Dr. Rashid Ismail, what does Land 70 mean for you?
Faruk?
Dr. Ismail, you are Lenasia first before me, but I think it's an important milestone. I know it started out of the strategy, not strategy, call it their strategy of apartheid. It rose, but
Yes.
Lenasia has really developed into its own. It's come into its own in many many ways. I mean, we have produced businessmen of high caliber, businesses of high caliber, socialites of high caliber. And in various fields, we've done well. You know it. People are busy celebrating it very much. I'm not a Lenasian in the sense of having lived there, but I spent many hours. In fact, I probably slept in Azadwal overnight, but worked in Lenasia, spent more time in Lenasia and times. But it's a proud time and proud moment. Never mind where it arose from. But I think it's a wonderful time,
Correct.
and well done to the people who are putting this whole 70-year anniversary celebrations together.
Mm-hmm. Dr. Ismail?
Yeah, well, as Faruk says, he's summarized it nicely. But
Mm-hmm.
I think Lenasia, very few people wanted to go and live there. We were forced to go there. But
Correct.
under the circumstances, we had to improve matters for the people living there. And I think since that time, I would say it's established itself into quite a profitable city. And I think the people living there, I wouldn't say all of them, but most of them are quite comfortable continuing there.
Mm-hmm. Well, yeah, we can be a bit critical as well, but we are coming to the end of our discussion. So I'm not going to elaborate further, but I just wanted to say that it is important to also focus on development and not just dwell on our glorified past, because it's the people like you that brought about this type of service. And the passion for it, and the continuation of such a service, and just the mindset around giving back, I think, should continue. And I think for me that is more important right at this point, because we're losing our young people, um, although they've contributed very well as well, and we're seeing more professionals coming out of Lenasia as well. But even though you've moved away or you're not part of Lenasia anymore, it's important for us to recognize that it is from this little suburb that was, people that were thrown out of the city under the Group Areas Act have actually come through, rising from the ashes. So thank you very much for sharing your story with us.
You're welcome, and thanks for having us.
Thank you. Thank you for inviting us, Najma. It was a pleasure to be on this show.
Thank you very much. We must thank you for your time this morning. All the best, and continue just our respect, and we honor the work that you do. Assalamu alaikum.
Alaikum
Wa alaikum
salam.
assalam wa rahmatullahi wa barakatuh.
All right, and that brings us to the end of our Land 70 podcast series. Yes, it has been a wonderful journey that we've undertaken together. I hope we've managed to bring about the awareness that we were hoping to via this program and the discussions that we've had. For me in particular, I think I just expressed my views on what we feel we need to do going beyond the 70 years, and looking back on the last 10 years or 20 years, and what kind of progress have we made. And I know the nations feel very different about, some the nations feel very different about living here, living there, I beg your pardon, and, just being so challenged in so many ways. Despite that, I hope we can revive that spirit of survival, of community spirit, and of course, of the social conscientiousness and giving back in the way that our people that have left behind such a fantastic legacy. We hope to continue in the legacy of those that gave, some of them, their lives as well. So with that, I thank you very much for joining me over the past few weeks on this special program. uh, Inshallah, if we meet again on the airwaves, we'll do so. Assalamu alaikum wa rahmatullahi wa barakatuh.